So here's an interesting position statement that was published in the British Medical Journal. It was from a few different interventional pain society organizations. They looked at where they thought utilizing steroid injections for typical procedures would be helpful and where it wasn't helpful. And while they found that it may be helpful in certain peripheral nerve injections, they also recommended no longer utilizing steroids in carpal tunnel and trigger point injections. So this is a big deal because even though for several years we've known that injecting steroids is not helpful in carpal tunnel or in trigger points, and it actually may be harmful in carpal tunnel, it's still been sort of the traditional way of practicing. And this is a big deal because number one, it shows that a lot of traditional medicine is starting to realize that while we know that steroids are unhealthy if utilized again and again and again, now people are starting to officially come out with that and make positions on that. Number two, let's then talk about what else can be helpful for these conditions. So for carpal tunnel, it is utilizing an injection like platelet-rich plasma and platelet lysate, which are the growth factors from platelets. Healthy for the tissue, not harmful for the nerve in carpal tunnel syndrome, and can give longer lasting pain relief than other types of injection procedures. Essentially what you do is you utilize, under ultrasound guidance, you inject a high concentration of platelet growth factors around the nerve, and then you also inject platelet-rich plasma around the ligaments that support the carpal tunnel as well. That supports the nerve and gives a longer lasting degree of pain relief. For trigger points, instead of utilizing steroid injections, because this is not an inflammatory condition, you can utilize what's called neuroprolotherapy, where you're injecting a low concentration of sugar water around the peripheral nerves in the myofascial tissue that get pinched and irritated and cause a lot of muscle pains and chronic pains as well. Much better than what people are currently doing, which is repeatedly every 3 to 6 months utilizing steroid injections in the trigger point areas and the muscle areas, which eventually cause a lot of other side effects. So there are definitely healthier options for treating these kind of conditions. And it's good to see that some of the poobahs and big names at some of these organizations are starting to recognize that.